So COVID has been terrible for our community. But one of the unintended consequences, I think, has been because people have had to examine themselves and the way that they've done things, and because the pandemic and also the whole issue around the murder of George Floyd has amplified the injustices and the health inequalities that we all knew were there, but there's no hiding place from them now. And also organisations, particularly the City Council, have had to acknowledge, and they have done so in a range of different places, that what happened on the back of austerity in terms of the decimation of voluntary sector organisations went far too far, and was a mistake. And they've had to acknowledge, and I think it's coming from a good place. They've had to acknowledge that communities of colour did suffer more than others. For me, that is progress. We wouldn't have had that kind of conversation and acknowledgement a while ago. What COVID and the injustices did is that doors that we didn't even know where the door was, we're now getting beyond the door. And, you know, we just have to capitalise on that and do the best for our community. So in the future, we've developed very strong links with the university, both Sheffield Hallam and the University of Sheffield. And James made reference to some of the research that we are attempting to do and doing in partnership. That people of African Caribbean origin are overrepresented in all the negative health indices, mental health indices and physical health indices. If I just give you two statistics, one from mental health and one from physical. When we started in 1988, African Caribbean men were 6 times more likely to be detained under the Mental Health Act than their white counterparts. In 2019, when the most recent data is available, African Caribbean men 6 times more likely to be detained under the Mental Health Act. That stat has not budged an inch in over 30 years. What is that about? Women of colour die 4 times more frequently than their white counterparts in terms of maternity care, antenatal care. Can't be acceptable. So we are trying to get to understand the stats. What is clear is that ethnic monitoring around the health system particularly is really poor. And from our point of view, we have been hesitant as a community about giving out too much information because we're not sure what they're going to do with it. But we have to be clear, and we're also very secretive people as well, but we have to be clear that information, if it's not counted, it doesn't happen. If we don't do something about it, we are still paying our taxes, we are still contributing, we are still citizens, so we're going to have to hold the system to account in terms of what they do with our data, but we need the data. We're trying to get some local data. There's lots of national high-level data, but good local data about our health inequalities is hard to find, so we're doing some work around that. We're aiming to have a conference in spring of 2022 led by a colleague from Croydon who has done some work around health inequalities in the African Caribbean community and has also done some work around modelling how we address some of those health inequalities. So we're aiming to do that in 2022. I'm really pleased that we have been able to get some additional funding from the Health and Social Care Foundation Trust to recruit a equity officer, race and mental health. I'm really pleased Sally Midgley, who's the senior manager from the Trust, is here today. That role is really about 2 things. It's focusing on restrictive practice on the wards in hospitals. So that's the numbers of people who are taken off, segregated, all that kind of heavy-end intervention, understanding that and doing something about that. In Sacmha's early days, we rolled out the respect policy in the hospital around restraint. That's what we did in partnership with the Trust. And the other element of that role is around addressing the issue of black male suicide. So the stats will tell us that just over 6,000, just under 7,000 people end their lives by their own hands annually. 75% of those are men in the under 55 age range. But there's no ethnic monitoring, so we don't know how many of those are men. So we've got men from our community. So we've got to do something about that as well. The job's out there, so if you know anybody's interested, it's out there. It's on the Voice website, the Guardian website. It's out there. Denise spoke about engagement. We have just got another round of the COVID Renewal Fund money from the council to take us up until March 2022. We will be doing much more around engagement with our communities, focusing on how we ease out of the strangest couple of years that any of us have lived through. Partnering with the CCG around cancer. Again, we are overrepresented in the cancer statistics, and so we are going to be doing some work around that with the view to hosting staff from our community, in our community, to do work particularly around prostate cancer, bowel cancer and breast cancer, cervical cancer, and making sure that people screen. We screen late. As a community, we screen late. So when we then do come into contact, the treatment often has to be much more aggressive than if we got in early. We are partnering with the CCG and Rethink, which is another mental health organisation, doing some work around mental health in the community for those to address the early warning signs and provide support there, and address those who are back in the community and who need some support, very much from a peer-to-peer support approach. And we have a number of service users who have contributed to the work around those roles. So there's a lot going on. There's a lot for us to do. I'm going to stop now because I want to get into the launch of the report. But what I would say is, go to our website. You've got a good delegate pack there, I think. Come and talk to us. We're really keen. Celia is our chair, and I know that I speak for the trustees and us as staff. We're really keen to collaborate and to make a difference for our community. Yes, we took a decision to widen the scope and work with other communities, but we always retain that priority of focusing on the African Caribbean community. That's not changing. We will work with other communities. We will collaborate. Come and talk to us. Thank you. I think you could give me a clap for that.